Welcome, welcome to a wonderful interview that we're going to be having today with Sue Paget. She's the CEO of RFHA Inc. And we are going to be talking today about the upcoming Rotary Family Health Day soft launch, which is coming up soon. Sue, you're going to furnish us with some of the detail about it so that people can learn more about it. I know that as a Rotarian, it is a very well-respected program and well-known within the Rotary community, Rotary Family Health Day. But Sue, there are so many people that are public that will be watching this video interview and who don't know anything about it, and where I believe we can add a huge amount of value by really just getting the message out there. So before I start with questions, Sue, you are amazing. I was reading your profile this morning, and I mean, in terms of Rotary, the world of Rotary in the community and outside the community, you've left no stone unturned with regards to community service. When you say service above self is something that you are living, you are not joking. You've been with Rotary for so many years, embraced so many amazing projects, and then landed in Rotary Family Health Day. Tell us a little bit about that journey, Sue. Talk to us about what led you to Rotary Family Health Day.
Oh, thank you. And thank you for those kind words. I stand very high on the shoulders of very many people, let me tell you. But my journey with Rotary International started about 20 years ago, where I was actually contracted by then past Rotary International Director Tony Serrano, who was looking for somebody in South Africa to run with the private sector funding for the polio campaign. So that was my first entree into Rotary, and I contracted with them for 2 years. And at the end of that, Tony said, would you become a Rotarian? And so that was the beginning of my journey. And what I've always loved is the internationality of our organization, the absolute power and dedication of 1.2 million people or Rotarians around the world who just give of themselves to try to make a better world. It's a very beguiling, passionate group that one can't help getting sucked up with.
That's awesome, Sue. And in terms of Rotary Family Health Day, tell us how it started. You know, what birthed such a wonderful program that leads us to where we are today, the biggest in South Africa, the biggest public-private partnership that there is. But I mean, it's way beyond South Africa.
Absolutely. So, Shereen, it's an amazing story. It was started by a woman in the early 2000s, the Rotary Action Group, which is Rotary Action Group for Family Health and AIDS Prevention. And the Rotary Family Health Day program is one of our programs. But in 2004, an American by the name of Marion Bunch, living in Atlanta, started this action group based on a terrible story that she had lost her son to HIV and AIDS in the 1990s, just before antiretrovirals became available. And she said, you know, to see the suffering of these young men at the time who'd been stigmatized by their families, by society, it was a really heartbreaking scenario for her. Anyway, fast forward a number of years, she was a Rotarian. Her journey brought her to Africa to try to do something about the plight of orphaned and vulnerable children, which was when I met her in 2004. And she ran an anchor program around saving these orphaned children. Then in 2011, her journey took her to Uganda, where she met a Rotarian leader by the name of Stephen Wanji. And he said, Marion, I've got this dream. He said, I want all the Rotary clubs in Uganda to work together on one day in an integrated health program, not just around HIV/AIDS. And I need you to help with putting a public-private partnership together, getting the funding, getting the medicine, et cetera, et cetera. Anyway, on the eve of those Rotary Family Health Days, Marion said, I'm not sure that anybody's even going to come to this. By that stage, she put the partnership together. 38,000 Ugandans queued overnight to attend the Rotary Family Health Days, and that was the birth of this program. Everybody knew that there was a huge need. She knew then that Rotarians loved working together. It was an integrated health program. The partnerships loved it because everybody had a defined role and responsibility. And so the program then moved to Nigeria, and it continues to run there. It moved to Ghana. It came to South Africa in 2012, where I was the appointed program director. And we now operate in 11 countries in Africa and also in India. But we know that we need to do more.
That is an amazing feat, Sue, to take on Africa and the world in terms of bringing a solution so desperately needed on our continent, for sure. What are some of the other countries that Rotary Family Health Day are in? You mentioned some of them now, I think 4 of them. Who are the other countries?
The ones in West Africa are Côte d'Ivoire, Benin, Togo. We are now bringing on Zimbabwe as a pilot program with a slightly different funding model in December this year. We're doing a pilot in Zambia, also leading up to World AIDS Day this year. And we're going back into Eswatini and Lesotho in Southern Africa. But, we know countries are crying out for community-based service models, and that is where we position ourselves in this massive public-private partnership.
That's amazing, Sue. And tell me, how did you engage and onboard our own governments, our national departments of health?
Another incredible story. One of the partners that Marion had worked very closely with in years gone by was the Centers for Disease Control in Atlanta. And we had wonderful backup from Sandy Thurman, from Ambassador Burks at the time, and they were the implementing partner in Uganda to deliver the actual services on the day. So when Marion wanted to bring the program to South Africa, she had a meeting with the country director of the CDC in Atlanta, and our DG at the time, Dr. Precious Matsoso, was there, and she said, "This sounds fantastic, taking services to the people. Let me take it back to our Minister of Health," which she duly did. And Minister Motsoaledi at the time said, "This sounds fantastic. Let's just give it a try for 1 year." And that was 10 years ago. And we've remained in this public-private partnership, which has grown enormously. Other partners have come on board. And I just think everybody's found their slot to work together to educate. So it's a really good story.
That is just amazing. The fact that our government has stayed the course from minister to minister with RFHA and really managing a very sustainable healthcare project says so much for what the government is doing in terms of health, and also the way that you've managed that relationship. So congratulations on that, Sue. Outside of government, I mean, obviously there's a lot of funding that is required. Who are the people that are involved with this project, and how do you go about securing that funding? And if somebody was watching this video today and they wanted to get involved, what would they need to do?
Thanks. Funding, for NGOs is always challenging. And of course, in the current climate of the pandemic, it's become really difficult. So over the years, RFHA has had some hugely powerful partnerships. We had the Coca-Cola Africa Foundation, who birthed us, and were our partners for the first 5 years. And I'm talking big funders in terms of South Africa and Nigeria, which are major markets. We've had the Gilead Foundation, we've had MTN South Africa, and then we have other implementing partners who bring resources to the table. So something that I think is really important in the 2018-19 program in Africa, for a cash donation of $1 million, the program value across the countries that we served was 45 million US dollars. And I think that's the ability of this public-private partnership, the neutrality of the Rotary brand, which is hugely important, that we can take $1 and make it 45, because everybody comes to the partner donating their services. So then to answer your question, how do people get involved? I think there's so many levels. One can get involved as a volunteer, one can get involved as a donor, one can get involved as an implementing partner or a resource partner, bringing something to the table. And then obviously we do need some funds, but those funds really go to supporting the Rotarians on the ground who run the program, because we don't expect them to not only give their time and expertise, but we don't expect them to fork out for it. So yes, everybody can find a space to work on a Rotary Family Health Day program. And I think that would be through contacting myself or the in-country director, because we do have a structure within each country.
And where would people find your details, Sue, or the in-country director?
Shereen, I think the website is the best bet at the moment, and that's www.rfha.org. And just to mention that we are redoing our website, which will go live at the beginning of December. But for the minute, one can definitely find contact details on that, and we'd love to hear from you.
That's wonderful. So, Sue, moving on to what is looming in the short term here in South Africa, which is a soft launch, a virtual event that's coming up with regards to Rotary Family Health Day. Can you share with us, can you give us a little sneak preview of what the theme is this year and what people can expect if they register online to attend this virtual event with regards to Rotary Family Health Day, which really is the prelude to World AIDS Day coming up in December?
Sure. Well, it is. It's really exciting. And of course, why we've gone the hybrid route is because of COVID-19. But we are still celebrating off the national health calendar, the Rotary Family Health Days. So what's wonderful is that we have Minister Joe Partschler, who will deliver the keynote address. We have our incoming Rotary International President, Jennifer Jones, who is the first ever woman president in a 150-year history of Rotary International. So that's an incredible big deal, and she will be delivering a speech on that day. And then we have messages of support from our long-standing supporters in South Africa. So we've got Dr. John Blandford, who is the country director for the CDC. He will give a message of support. We have great representation from the South African National AIDS Council, from the CEO, from the Private Sector Forum, from the head of civil society, Ms. Steve Letsiki, and we have the Deputy Minister. And yes, there's some incredible speakers, because I think the important thing, Shereen, to note is that COVID has occupied all of our minds quite rightly for so long, but it doesn't mean that any of the other diseases have gone away. So the importance of the Rotary Family Health Days going forward is going to be paramount as we address other diseases, but including vaccinations around COVID-19.
Perfect, Sue. And the focus for this year's event at Rotary Family Health Day, can you share a little bit with us about that?
Yes, of course. Over the last 3 years, Shereen, the Minister has deemed that the Rotary Family Health Days will always signify the kickoff of World AIDS Day, the World AIDS Day theme. So Dr. Joe Parshler, or Minister Parshler, will be announcing the World AIDS Day theme on that day. So that's always really exciting. We don't know what it is because that's kept under wraps until the launch. Then obviously there is an emphasis on the call to action for South Africans to become vaccinated. So we will be doing a vaccine rollout on that day. And then the third important factor is that we are celebrating the involvement of people living with disability. So there will be a huge focus to be including people with disability in all activities to ensure that those with special needs are not left behind. So it's a good program.
That's amazing. That's amazing. The inclusiveness of people who have disabilities, I think, is so important in terms of the rollout, because there are so many people who just don't have access, based on the limitations that they have, and that Rotary, RFHA, Department of Health are bringing that to the fore, I think is commendable. Sue, it has been amazing to chat with you. Can you believe we've come to the end of our interview time? Obviously, this video will be posted on YouTube and all other social media platforms, along with a link so that the public can register for the soft launch. I really look forward to the unveiling of the World AIDS Day theme, and just thank you so much, Sue, on behalf of all South Africans and Africans and people around the world, for your dedication and commitment to this program. It is actually a life and death program. And your impact and your commitment cannot be underestimated. So, Sue Paget, thank you so much. It's been an absolute pleasure to interview you, and we will see you again online virtually at the Rotary Family Health Day launch. Thank you so much.
Thank you, Shereen. Thank you.